Okay, so for those who don't know me, my name is Moulton. I'm a neuroradiologist at the Royal University Hospital, and my quick talk is on implementation of a tailored MR stroke protocol. So I'm just going to give you a brief overview of the project. No time to get into details, but the aim of my project was to reduce stroke MRI time by 25% through the design and implementation of a dedicated MR stroke protocol. So this is kind of a timeline of how my project went. Basically, it's just kind of going from left to right. We kind of identified the problem, formed a team, implemented the protocol, formed an interim analysis which showed less than expected utilization of about 40%. So that kind of triggered an internal plan, do, study, act cycle, which pointed out, a couple problems. One of which actually boiled down to a single neuroradiologist not using the protocol. So we were able to address that problem and then move on to a second interim analysis which showed improved uptake of the protocol. And then a final analysis which showed good reduction of MRI time by about 17%, though it fell short of our aim. So that's to say that there's a lot more work to do, as well as I plan to spread some of the gains that we made to other sites. So lots of work left to do with it. What was kind of cool is when I took the timeline of the project and then just applied the concepts that were used from the various workshops and units that we went through. It was pretty clear to me that these concepts really did build on each other. And you were kind of borrowing from all the units until the point at the very end where you're using basically the whole curriculum to get to the final stage. So I thought that was cool. This is this is kind of graphically representing what we had accomplished. This is just to basically show that I had no idea what this was, how to generate it, or how to interpret it before this course. So I thought that was kind of cool. In terms of my personal reflections on learning, I've kind of gone over this a little bit, how the concepts that we learned really built on each other to kind of guide you through the project completion. But at the same time, it kind of forms a tool set in the sense where you can kind of reach back into that tool set, pull out any one of these tools that we've learned, and apply as needed during the project, which I kind of did, which kind of leads into the second point here of dealing with people can be really difficult sometimes. And so some of these softer skills that were emphasized through the workshops and course actually I found quite handy to help my project actually gain traction and get the improvements that we did. In terms of how it affected my personal philosophy, well, it kind of gave me a new philosophy to work with, so the philosophy of QI, by learning the language and the conceptual framework of QI in a formal setting. I could actually now look at these QI problems, and what would otherwise be incomprehensible is now understandable and attackable. In terms of my reflections on the experience, the aha moment came to me, well, the most memorable one came to me a little bit earlier on in I think it was workshop number 2, where we talked about improvement being an iterative process. And you have the freedom in these projects to actually revisit your assumptions and refine your approaches, which to me was extremely liberating. So I felt like I had this weight of the P of less than 0.05 taken off my shoulder. The successes I gained with the project were gaining comfort with complexity, which some of these tools, the driver diagrams and fishbone diagrams, were kind of alluded to earlier. This being quite useful. And also gained a measure of comfort with measuring and implementing change. Challenges we faced, this is kind of something that kind of dogged us throughout our project, is separating QI from research. Our problem really was that this protocol hadn't been formally kind of studied or implemented in the literature. So the question is, what if improvement requires innovation? So we kind of struggled with that a little bit throughout the project. And I look forward to the challenge of spreading change. So in terms of the next 6 to 12 months, I plan on sustaining and spreading the project to St. Paul's and the City Hospital, continuing to develop my leadership skills by cultivating and championing QI within radiology, as well as teaching and spreading QI by taking advantage of my position at a teaching hospital to basically impart those stuff on residents, conduct QI rounds, as well as to help coach Cohort 3 and collaborate. I look forward to collaborating with Dr. Oyedokin and Weeds on their project.